Hello, my name is Susan Hilsenbeck and I am a cancer biostatistician. I'm also a professor of medicine and the director of biostatistics and informatics in the NCI designated Duncan Cancer Center here at Baylor College of Medicine. I focus on collaborating with basic and clinical cancer researchers to bring the very best experimental design and methods of analysis to their research. I'm especially interested in biomarkers that can help predict cancer prognosis or can identify people who will benefit most from specific therapies. In essence, I've been working on personalizing cancer care for my entire career. I recently became a member of the Scientific Advisory Board of the V Foundation. As the first biostatistician to serve on the board, I helped the board select the very best research to fund. Although I am new to the board of the V Foundation is not new to me. I first became aware of the V Foundation's support of innovative cancer research nearly 20 years ago when I helped a junior colleague to successfully apply for one of the earliest V Scholar grants. Over the years, in my collaboration with V Scholars and the V Foundation funded investigators here at Baylor, I have been tremendously impressed with the cutting-edge nature of the funded research and how important and transformational such awards are, especially to young cancer researchers. Two great examples of this are reflected in the work of Drs. Trey Westbrook and Wong, who are participating in groundbreaking basic and clinical research here at Baylor. So now it's time to pass the V.
Hello, my name is Trey Westbrook. I'm a cancer geneticist and also an associate professor of genetics and biochemistry here at Baylor College of Medicine and the Duncan Cancer Center. Our group's focused on discovering the weaknesses of cancer, breast cancer in particular, and translating those weaknesses into new cancer medicines. Unfortunately, those weaknesses are often hidden from scientists because of the complexity of our genomes. But we've developed new technologies that enable us to scan our genomes and unmask these weaknesses, these vulnerabilities of breast cancer and other cancers. With the support of the V Foundation, we've not only discovered some of these cancer weaknesses, but have transformed these discoveries into new treatment approaches for breast cancer patients. In particular, our studies have laid the groundwork for novel ways to treat triple-negative breast cancer, a common and aggressive form of breast cancer that is resistant to current therapies. And using these new ideas and treatments, we've begun clinical trials here at Baylor to help women fight this aggressive form of breast cancer. We're so grateful for the support of V Foundation and its partners, who have a track record of funding high-risk, high-reward science and supporting young innovators with fresh ideas. And on a personal note, as the son and brother of cancer survivors, I'd like to thank the V Foundation for their passion and resolve in supporting cancer research. Now, it's time to pass the V to my colleague, Dr. Wang.
Thank you, Dr. Westbrook. My name is Wong, and I am Associate Professor in the Department of Pediatrics at Baylor College of Medicine. I am a pediatric oncologist with the Texas Children's Cancer Center and specialize in taking care of children with bone cancer, such as osteosarcoma, which is the most common type of malignant bone tumor seen in children and adolescents. I also have a translational laboratory focused on understanding the molecular basis of osteosarcoma through the study of a rare genetic condition called Rothman-Thompson syndrome. Patients with this syndrome, caused by mutations in a gene called RECQL4, have an extremely high and specific risk for developing osteosarcoma. We are currently investigating the role of RECQL4 in the molecular pathogenesis of osteosarcoma. I was fortunate to receive a V Foundation Scholar Grant back in 2005 when I was just starting out my laboratory. The support of the V Foundation at that critical stage of my career was instrumental in allowing me to receive subsequent NIH funding and to continue my research on osteosarcoma. I am extremely grateful to the V Foundation for all it has done and continues to do to support young investigators.